Welcome to Wealth Roadmap with Jeff and Steve, your guide to simplifying wealth management. Join us as we explore financial planning, taxes, investments, insurance, and legal frameworks to help you secure your financial future. All right, welcome everyone to episode 5 of the Wealth Roadmap with Jeff and Steve. I am your host, Jeff Costello. I have Stephen Benny here. Today, we're going to dive into Medicare. For those of you watching, we are in the same outfits because we just recorded one podcast and we're going into another one today.
That's funny. I didn't even think of that. But is this 5? This is 5 or 4?
Yeah, we just recorded for 30 seconds ago, and now we're diving into 5. We're doing them back to back.
Time flies by with you, Jeffrey. Time flies by.
Back to back, like Jordan, 96, 97, back to back, like on the cover of Lethal Weapon. Here we go. So Medicare, we teach classes on it. I think baby boomers, there's 10,000 turning 65 every day. And for those of you that don't know, Steve Benny won Best Smile in high school. He was pretty popular, but not as popular as a 64-year-old heading into Medicare with all the pamphlets, the brochures that you're probably getting, the phone calls. You know, one day we'll have a survey who was more popular, you know, someone approaching Medicare or Stephen Benny, Best Smile in high school. But for today, we're going to dive into Medicare.
I don't even know how you knew that. By the way, Jeff, we didn't know each other in high school. The guy did some digging. Let me tell you, the guy did some digging, but it's true. That is true. I did win that, but it's more so true that you are one of the most popular people when you turn or close to turn age 65, and that is one of the things that is. Just we hear it all the time. Everyone, they don't know where to go because
is there going to be a combustion in the universe when you turn 64 in Medicare with just the overpopularity of Best Smile approaching Medicare age?
See,
we're getting a little bit on the ramble. Let's dive into Medicare.
It's all rooted in jealousy. That's the problem. The guy wishes he had a smile like this over here.
All right, let's dive in. See, where do you want to start?
You know what? Let's go. Let's bring it back to like the basics. Because Medicare, right? There are different parts. First of all, okay. There's A, there's B. I think there's C, there's D. Tell me a little bit about. Okay, 64. And I'm going to be turning 65 in 6 months. What's the first? What should I be doing? And really, should I say, am I too early, too late? Should I have started at 64 looking into it? Let's start there.
All right, perfect. Yeah. So if you're when you're approaching 65, you are eligible the first of the month that you turn 65. The only caveat to that is if you're born on the first of the month. If you're born on the first of the month, then you're actually eligible the month prior. So, for example, if you were born on June 1st, you can actually start Medicare on May 1st. But that's, very obviously rare. So let's talk about the person that was born on June 17th. If they're born on June 17th, they're eligible for Medicare on June 1st. Now, Jeff, I'm 6 months away. What does that look like? There's nothing that really you can do now. You can do your research. You can listen to this podcast, start to get your ducks in a row. But there's really nothing that you can do until you get to 3 months prior. 3 months prior. So again, if in this case it's June 1st, for example, 3 months prior, March 1st, that's when I'm able to sign up for Medicare. I'm able to go online on Social Security and sign up for Medicare Part A and Part B. We'll get into the different parts in a second. But once I'm 3 months prior from my eligibility date, that's when I'm actually able to jump onto
So
Medicare.
that's the starting point, right? I'm 3 months prior to 65. Boom, that's when I got to start getting my butt in gear.
Yeah, so Steve, so with Medicare, right? There's a few different, um, it's like a game of dominoes. There's a few things that have to fall first. The first thing that has to get done or processed is signing up for Medicare. So before you can look into any of the prescription plans, which we'll get into, the Medigaps, the supplementals, all that different stuff, you have to get Medicare squared away.
Okay.
And Medicare is not, they're not the fastest moving organization. So if you're eligible June 1st, don't start the process on, May 15th, thinking that you're going to get your card in on time and everything like that. Try to do it, 2 to 3 months prior so that you get your Medicare card, because you're going to need that number to sign up for all of the other different parts, which we'll talk about in a second. So again, that 3 month window, once that starts, please start the process in getting signed up for Medicare.
And that's Medicare Part A.
Great segue, Steve. So with Medicare, there's a lot of different parts. It's not
Many
like your
parts.
old insurance plan that you may have had through your employer, where you had Blue Cross Blue Shield or United Healthcare or Aetna, whoever it might have been, where everything was with one provider. It was super, it was simple, it was easy. Being that you're approaching 65, the government just wants to make sure you're still there. So they're going to make it a little bit more confusing on you. But with Medicare, there's a few parts. A and B is what you get from Medicare. Part A is free. That's your hospital insurance. So if you get admitted into the hospital, they're billing Part A of Medicare. Part B is your medical insurance. That's, your doctor visits, your outpatient surgery, things like that. But both parts you're getting from Medicare. Part A is free. Part B, there's a cost to it, which we'll get into in a second. And then the other items that you're going to need is either a supplement to pick up what Medicare A and B do not cover, because A and B do have holes in coverage. There's 20% coinsurance that you're still responsible for. There's no maximum out of pocket, meaning that, theoretically, if you just had A and B, you could owe quite a bit of money if you got admitted to the hospital or things like that. So people get a supplemental policy to kind of help fill in those gaps. And they sometimes refer to it as a Medigap policy. So you'd get a supplemental policy, and then you have to get a prescription plan. So again, there's a lot of different parts. Or you can just sign up for Medicare Advantage, which has its pros and cons, which we'll get into in a second, where it just combines everything, similar to like what you've had in the past. But in terms of original Medicare, you're getting A and B from Medicare, and then you're getting a supplemental policy most likely, and then you're getting a prescription plan. So again, 4 parts.
So A and B, original Medicare. You mentioned the Medicare Advantage. That's C. Okay. So A,
Mm-hmm.
B, C, and D. You mentioned prescription drug. That's Part D. So we got A, B,
Correct.
C, D right there. Now, the supplemental plan though is that A, B, C, D, E, or is that just considered a supplemental plan?
That's just called a supplemental policy. And
Got it.
just because, they want to make it that much more confusing, the supplemental policies, in terms of how they rank the coverage level, are more letters. So you can get a supplemental policy. Plan G is in George, Plan N is in Nancy, Plan F is in Frank was popular, but that's kind of gone away at this point. But yeah, so there's a lot of different, letters here when it comes to Medicare, and trying to get them all sorted out is pretty confusing. But when it comes to original Medicare, if you're getting A and B, again, from Medicare, you're getting Part D, which is your prescription plan, and then you'd get a supplemental policy. Let's call Plan G as in George, for example.
Got it. Yeah, got it. But like you said, each supplemental policy can be or does have its own letter, regardless. But
Correct.
okay,
Yep.
all right. So good. That's actually very clear. So thank you. So Medicare Advantage versus original Medicare, or I should say, I didn't say that right. I should say Medicare Advantage versus maybe a supplemental. That's a big question that I often get, and that we are always discussing with people.
Yeah, and so before, just because I want to kind of touch upon what we were talking about before with eligibility,
Yeah.
um, you know, again, you're 3 months out. Okay, I want to go sign up for it. You are not required to sign up for Medicare if you get group care, you get group health insurance from an employer with more than 20 employees. 20 employees, that's the line. So for example, if you're working for Johnson and Johnson, Bank of America, you're working for any company with more than 20 employees, and you get your group health insurance coverage there, you have what they call credible coverage. If you're the dependent, if you're a spouse and you get your health insurance coverage from your husband who gets it from Johnson and Johnson, that's included. So you do not have to sign up for Medicare. Now, at that point, it'd be good to compare, again, what you're getting from your group healthcare coverage versus what Medicare is going to cost and what that all looks like. And you can do a cost analysis to see what makes the most sense. But you are not required to sign up for Medicare if you get group health insurance coverage from an employer with more than 20 employees.
Or
If
your spouse.
Or your spouse, correct.
Got it.
But if you're working for Joe's Deli and there's only 5 employees there, you need to sign up for Medicare Part A and Part B. Otherwise, there will be a penalty. Um, and you know, everyone listening to this podcast, they're smart. They're going to do the right thing. We don't have to dive into like what the penalty looks like, but if you're approaching 65, and again, you're either maybe if you're self-employed and you have an individual health insurance plan, or again you're working for Joe's Deli and there's only 5 or 10 employees, you have to sign up for Medicare. Medicare is primary at that point. Um,
Got it. So,
so we get that question a lot, and a good example of that, Steve, is my grandmother, God bless her soul, worked until she was 78. Um, and at that point, because she worked for a company that had more than 20 employees, she was on a group health plan up until that point. And then when she decided to retire, she at that time signed up for Medicare. So she transitioned very easily from her group health insurance plan over to Medicare without any gap in coverage or overlap or anything like that.
so,
Um,
so, so in that case, Jeff, when did she have to sign up
yeah,
for?
so Yeah, so at that point, she's going in with, and I forget what the form number is called, but she's going in with just showing to Medicare that, hey, I have credible coverage. So if she knew that, for example, she was going to retire on October 1st, and I don't know, let's pretend that it's August, at that point, she would go in and she would say, hey, sign me up for, Medicare Part B effective October 1st, because that's when I'm going to leave my employer. Um, she alerts her employer. They fill out the form that goes into Medicare showing that she had credible coverage these last 13 years. So she's all set. There's no penalty, right? Because again, she was covered with an employer these last 13 years, and she would just start on to Medicare at that time. Now, if it's September 21st and she's like, I've had it. I'm out. I'm retiring October 1st. She can sign up for Part B and all that different stuff. It's just going to take time for them to process the application on
Right.
Medicare side. So she wouldn't have an issue unless, she's running to see a doctor on October 3rd. They will backdate that effective date to 10/1, assuming that she does it, again on September 21st or so. But yes, you should not have any issues with transitioning from her group plan uh, onto Medicare. And, we've seen it with clients of ours, right?
Oh yeah.
Transition over, again, who were 68 years old and deciding, hey, I'm going to retire at this point. Maybe they're still working to get, they don't want their spouse to have an individual plan for whatever reason. So maybe they want to work, so long so that their spouse reaches Medicare age and now they're both ready to go on Medicare. And so at that point, they jump on.
You mentioned for Part B, but go back. What about Part A? Is Part A? Is Part
Great
A?
question. So Part A, there's no cost. So Part B is really the one that
That's the cost.
you have to elect because there's a cost to it and everything like that. And the reason why I didn't mention Part A for someone like my grandmother is when she was 78, she was already taking Social Security.
That's right.
When you elect Social Security benefits, retirement benefits, right? So you're getting an income stream from Social Security retirement benefits. They automatically enroll you in Part A. So my grandmother, who's 78 years old, she has Part A. She does not have Part B because she has group health insurance through her employer. And then when time comes for her to want to retire, at that point, that's when she would say, "Hey, give me Part B now, and give me my supplement, my prescription plan, and all that different stuff." And that's a great point that I forgot to mention before. Um, if you elect Social Security, they're going to enroll you in Part A. Now,
Assuming you're 65 or older.
correct. If you're, let's pretend, 63 years old and you decide to elect Social Security retirement benefits, when you are approaching age 65, they are going to automatically enroll you in Part A and Part B. So if you're listening to this podcast and you're below age 65 and you've started collecting Social Security retirement benefits, expect to get a Medicare card in the mail. They are going to automatically enroll you. If you do not want to be enrolled, you can simply go to the local office, and come off of Part B. Again, if you're taking Social Security benefits, you're automatically enrolled in Part A, but Part B, you can still come off in the event that, again, you have group healthcare coverage or whatever the case might be.
Got it. Yeah. Cool.
Now,
So
in terms of the cost, um, for Part A, again, I mentioned like that's free. Um, Medicare, and we kind of, I don't know, did we touch upon uh, Medicare costs as a stealth tax during the tax conversation? Maybe a little bit.
we may have briefly touched on it, but wouldn't hurt to quickly touch on it. Yeah.
Yeah, so
Yeah.
Medicare, and this is where like working with an advisor like Steve or is crucial because Medicare, the premiums for Medicare, right? It's the same coverage. If I have A and B and my cousin has A and B, it's the same coverage. What's different is what we pay for that coverage. And that is based off our income. And what they do is they look at our modified adjusted gross income from 2 years prior. Now, for 2024, or I'm sorry, actually, let's backdate. 2022, the premium for 2022 was $170. For 2023, it went down to $164. And then what happened in 2024 is it came back up to $174. So depending on what year you're listening to this podcast, if you're listening in 2024, it's $174. Next year, 2025, it might go up, but again, it's going to be around hopefully that number. Now, in terms of how much you're going to pay, or I'm sorry, that 174, again, I mentioned it's all based off your income. So what they do is they look off your income from 2 years prior. And so in 2024, they're going to look at my 2022 income tax return. Why is that? Well, they don't know really what I made in 2023 because as we're recording this podcast, I haven't, or most people haven't filed their 2023 tax returns, but they should have everyone's returns on file for 2022. So they always do 2 years back. So if you're listening to this podcast in 2026, they're going to be looking at your 2024 tax returns. As they stand today in 2024, the 2022 bracket, if I am married filing a joint tax return in order for me to pay $174, my income along with my wife has to be below 206,000. There's brackets that go up. So for example, if I'm between 206 and 258, my Medicare premium goes up to 244. So, and this isn't a prorated amount. So if I just go into that next bracket by a dollar, by $10, my premium goes up, my wife's premium goes up. If
And
I'm
we call that a cliff, right? I mean, by a dollar, you miss it by a dollar, boom, you're in that next bracket.
Yeah, we call you call it what, a stealth tax, right, Steve? You
Yeah,
know,
yeah,
um,
yeah.
again, if you're at $200,000 of income calculated, and you're like, hey, you know what, I'm gonna go one more trip before the end of the year. I'll take out 10,000. Normal person might say, oh, well, I'm in the 22% tax bracket. I'm gonna pay 22%, in taxes, so I'll withhold 22%. But well, now my Medicare premiums just went up, $80. So did my wife, right? Every month, not including what I'm going to get into in a second with your prescription, because your prescription costs can also go up. So you want to look at what the tables are for Part B and Part D. They call it IRMA. It's called income related monthly adjustment amount. IRMA is basically, again, how much you're going to be paying for your Medicare. They calculate this, again, based off your 2 years prior tax return. And what they do it on is what they call your modified adjusted gross income. Now, currently, on the tax form, because again, the tax laws may change in a few years, but right now they're looking at line 11 of your 1040, which is your adjusted gross income. So if you go to your 1040 from 2022, you go to line 11, you're going to see a number. You're going to add your tax exempt interest, which is from line 2A of your 1040. So you're going to take line 11 and line 2A, you're going to add them up. And if that number puts you above the 206, you're paying more for Medicare. If it puts you above 322, you're paying more for Medicare. And so, again, Medicare coverage is the same. So one person could be paying 174, and then it brackets all the way up to the highest bracket right now is 594. So you could have two people, one person with Medicare Part A and Part B paying $174, another person paying $594, just based off of how much money they made 2 years prior.
Yeah, it seems mind-boggling actually, but and this is one of the things. Look, if you really put it into perspective, Medicare, and I know we didn't get to the supplements and everything, but the cost of Medicare, especially if you're coming off of health insurance, economically, the cost of Medicare, it's pretty competitive, okay, from a standpoint of what you get for the cost as far as the benefits. And then when you look at IRMA, and when you look at the I guess that we could call it that stealth tax, as and I'm using air quotes just to that is not a technical term. That's just a term that we made up here. Again, just get through compliance. Want to make sure we understand that here. So the thing about it though is Medicare is under some pressure, right? And the could there be a potential for in the future, whether it is the cost for it, right? The additional cost increasing, or looking possibly at the brackets, the income brackets, right? Could you get to a higher cost with less income? Could they change those brackets? It certainly is a possibility. We always say we want to plan for the worst and expect the best. We don't know, but it is one of the areas that we do know has some downward, or I should say, has some pressure, especially from a funding of that liability. And so, in order to help with that, changes will most likely have to be will have to be made. So, it doesn't seem too terrible in the scheme if we look at it and put it into perspective, but it is also something that, going back to, while it doesn't isn't necessarily all too bad, one tiny mistake, it could pretty much make you pay more than what you should have. So you just want to. So two things: you want to be smart about it. It's not the end of this. We're not trying to say that this increase or this tax that you have to pay is going to derail your retirement. It's more so just to be aware of this, so that you make the right moves, but also protect yourself for the future. And I think having an understanding that's I think the key here is just get a understanding of what we're talking about, so that you can, whether it's with your financial professional, of course, if you have questions, feel free to reach out to Jeff and myself. But that's really what we want you to be able to get from this, because that can keep more money in your pocket and give less to Uncle Sam, but also can I don't want to be repetitive, but can set you up for the future. So yeah, I just wanted to kind of jump in there, Jeff.
Yeah, and so with how much money, regardless of what it's going to cost, depending again on what year. Like, and again, if you're listening to this in 2024, you may be saying, well, Jeff, yeah, I'm retiring. Steve, Jeff, I'm retiring in 2 months. I was making a lot more back in 2022. I was getting bonuses, everything like that. I can't afford this higher premium that they're trying to give me when my income is taking, a reduction. There's a form that you can file called the SSA, I think -44 form, and it's basically an appeal to Medicare saying, "Hey, yeah, I was making $400,000 yet back in 2022, but I'm only making $130,000 now. Reduce my Medicare premium." And you have to fill out a form, you have to show proof, and they should be able to reduce your Part B premium to reflect, what your anticipated income is going to be for the next year. Um, but when it comes to all the different costs, right? Because like Steve mentioned before, there's a few different parts. You got A, B, C, D. Like, what does it all cost? Well, you have. Let's just pretend that you are underneath that threshold of that 206 married filing joint, or 103, I think it is for single. Let's pretend you're under that threshold. Part B is $174 currently.
Per
You're
month.
paying that per month. Then you're going to get a supplemental policy. Let's pretend that you're going to get Plan G as in George, depending on where you live, what state. But right now, where we live, I think a male is going for around $180 or $170. So you're going to add that. Then you're going to get a prescription plan. There's plans that range anywhere from $0 all the way up to $100. It depends on, how good of a prescription plan you're going to pick. But I would say most people are going on a plan that's around $10. So once you get that prescription plan, that's it. So you have $174 from Medicare Part B. Let's pretend you have another $170 from your supplemental policy with Plan G as in George, which could be from whatever carrier. And then you have your prescription plan. So what are you at? You're at like 354 or so,
Yeah.
give or take, in terms of all in monthly premium.
Yeah.
Now, there's, again, going into, what Part B is going to charge. I mentioned it's $174 a month. They're only going to bill you that monthly if you're taking your Social Security check. If you're collecting your Social Security check at age 65, 66, whenever it is that you go into Medicare, they'll withhold it from your Social Security check. If you're not collecting your Social Security benefits, they will bill you that quarterly. So instead of you getting billed $174 a month, you're going to get billed $400 and change. Again, whatever the quarterly amount is on that, every quarter until you elect your Social Security benefits, and then at that point, they'll start taking it out monthly. But again, when it comes to going the original Medicare route with getting a supplemental, you're looking at that, yeah, like mid, what did we just say, 354?
Yeah, yeah, three, and let's round up, say four. And the benefits too with the supplemental, Jeff. I mean, they're pretty rich, right? As far as them covering, um, what there's a deductible, and then after that, it's pretty much covered.
Yeah, so I mean, with like if you're getting a traditional Medicare, again, you're getting Part A, you're getting Part B. The only thing that you're responsible for paying for, with regards to the is the deductible for Part B. So I think right now for 2024, let's look it up. It's $240 currently, and
Right.
that number is going to fluctuate just like the premium. So 2024 is $240. Maybe next year it goes up a little bit, but if I'm going traditional Medicare and I'm getting Part A, Part B, a supplemental, I'm responsible and I'm getting that supplemental. That's a Plan G. What Plan G is basically doing as a supplemental, regardless of whether I have Mutual of Omaha, AARP, Aetna, Cigna, that company is basically picking up everything that Medicare does not pay for outside of the Part B deductible, which is $240. So what I would tell someone is, hey, you're going to have, yeah, a few different cards, but I know that your worst case exposure is most likely just going to be that $240 Part B deductible. Once you've paid that, Medicare, Part A and Part B are going to team up with your supplemental policy and pay for 100% of the cost so that you, Stephen Benny, or whoever's on Medicare isn't there holding the bag for any other medical expenses. Now, if you don't get a supplemental policy or you get a more watered down plan, maybe like Plan N, where the premium is a little bit less, but now it makes you have to pay more copays and things like that, then yeah, it's just like any other insurance where yeah, you're paying less, but you're um, getting worse benefits. But you mentioned before, Medicare Advantage, like Part C. What does that look like?
Yeah, yeah,
So
yeah.
Part
I
C,
wanted to
and
ask.
this is what, yeah, and so this is where you see it usually on TV. You see Joe Namath come on or whatever celebrity talking about the best new Medicare Advantage plan that's going to give you dental insurance, cover your gym membership, um, you know, provide X, Y, and Z. With anything in life, right? It's a give and take. And so with those plans, the premium is lower, and that's for a reason. Their premium is lower, but now you have to make sure that your doctor is in their network. When you have original Medicare and you have a supplemental policy, if you have Plan G, like we were referencing before, when you go to the doctor, you just have to make sure that they accept Medicare. And Medicare is a national program. So whether you're in California, New York, New Jersey, Florida, North Dakota, Idaho, Ohio, you're covered because you're in a national program. They process all of the claims through Medicare, and then Medicare tells your supplemental policy what is left. So if you have a Plan G and it's with, again, Mutual of Omaha, you don't have to make sure that your doctor accepts Mutual of Omaha. You don't have to make sure your doctor accepts AARP or United Healthcare or anything like that. They're processing all of the claims through Medicare. And then again, Medicare is just sending whatever else might be owed to your supplemental policy. Whereas with an Advantage plan, you are not supplementing A and B, you are replacing it.
Hmm.
So now you do not have Medicare. Now you have an Advantage plan, and let's say it's with Humana. Now you have to make sure that your doctor is in that Humana plan. You have to make sure that your plan doesn't require referrals. A lot of them do. And if your Humana plan is a plan down in Florida, it might not cover doctors or hospitals up in New York or out in California. A lot of the Advantage plans are territorial, and they're based off of, again, whatever state that you're living in. So you're going to be paying less per month in premium. However, when it comes to the benefits, you're going to have a lot more out-of-pocket costs, higher deductibles, higher copays. You might be paying closer to $5, $6, $7, $8,000 out of pocket in copays per year, right? If shit hits the fan, so to speak. Whereas with traditional Medicare, again, you paid that 240 deductible, you're all set. So with all insurance, right, it's a pay now versus pay later. But obviously going into retirement, at this age, this isn't really the time to, in my opinion at least, uh, to scale back on health coverage.
Yeah, especially being the fact that as you get older, what happens? Well, typically you're going to need a little bit more healthcare than you did when you were younger.
Yeah, and also like again, not all Advantage plans are bad, right? I would say the you know the retail ones, you're not the retail Advantage plans aren't going to be as good as the ones that you may get, working for a school district or working for a local union, or some of the larger Fortune 500 companies now offer healthcare coverage into retirement, which kind of mirror an Advantage plan, but
Right.
those plans are a lot juicier compared to what someone off the street can get from a commercial that they see. um, again, and that's where working with a professional, just kind of compare the pros and cons versus all the different plans so you can make an educated decision there.
Yeah, and ultimately someone who you trust so that you feel comfortable with the recommendation too.
Yeah,
There's a lot,
exactly.
we do a lot, whether it's on the podcast, workshops. It's if you're concerned, if you're confused, so is everybody else. It's one of those things where uh, you get so much information, you get kind of like just paralysis by analysis. So
Yeah.
if there's
Yeah.
questions, please go send us go to the our website, send us a question if you have one. That's what we're here for. Our team will review it. One of us will review it. Make sure that we get some answers to help at least point you in the right direction, because we know that navigating this um, topic isn't as easy as one would think it would be. I think the other day, Jeff, we were doing a workshop at a local college, and there was a gentleman who came up, and his first thing that he said to me was, "Why can't we find information other than at workshop like these? Why is it so difficult?" I wish I had a better answer
Yeah.
for him. Yeah. You just don't get taught this
And it's
stuff.
just like that. Yeah. And it's a lot like diet, right? I mean, yeah, there's a ton of information out there and everyone
Yeah,
has their opinion, again,
true.
again, for me personally, I'm more of a more geared towards like original Medicare, but there might be someone out there that likes the Advantage plan.
Yeah.
There are a lot of great resources out there. When it comes to like for example, the prescription plans, when you have to get a prescription plan, and that's something that you can change every year during open enrollment. But if you're jumping onto Medicare for the first time and you're kind of nervous of what prescription plan to pick, you can do it all on Medicare's website. Medicare has a tool where Jeff would go on, I'd put in my pharmacy that I'd use, right? So I put in my zip code, I select the Walgreens pharmacy that I use in my town. I can maybe even select a few others, like Walgreens, Costco, whatever, CVS, just to put a few to see if there's going to be a difference in cost. And then I put in my prescriptions, and Medicare is going to tell me, right? They have a tool that's going to tell me what prescription plan is going to make the most sense.
Hmm.
So what their tool does is it adds up the the different plan options that I have. So if there's 27 different prescription plans for me to choose from, it's going to add up the total premiums for the year within those plans, and then it's going to calculate how much I would have spent based off those plans within the pharmacy that I chose throughout the year in copays. And it's going to total all of that up, and it's going to sort, and it's going to say, hey, Jeff, yeah, you could pick out this better prescription plan for $30 a month, but your copays don't get reduced by that much. It makes a lot more sense for you to pick this $10 a month plan. And yeah, your copays are a little bit higher, but throughout the year, you're going to be paying a lot less cumulatively between premiums and copays than you would any other plan. And you can see that with the pharmacy that you use, or maybe I'll save a few bucks by going to a different, CVS. And at that point I can make the, distinction. Hey, do I want to save $5 and switch pharmacies? Nah, I'll just stick with what I have. But, again, that's a great tool on Medicare's website when it comes to, figuring out what prescription plan. And it's something that we use. So if I'm working with someone and trying to hold their hand on the Medicare front, we'll show them, hey, look, we did it all on Medicare's website. We recommend signing up with, this prescription plan. But yeah, navigating Medicare can get pretty overwhelming.
Yeah, I would say so, without a doubt. But no, I think that was great, Jeff. The overview. And maybe in another episode we'll dive deeper into different areas around this. One of the things we're thinking about doing too, because we've been getting a lot of questions, is send the question in. As I mentioned, we could even talk about it on an episode. So if there's something that we didn't address, what we're doing right now is compiling a lot of the questions that we're getting. The plan is to be able to address questions on air on the podcast, so that we can give answers live, and that way we can get questions. I'm sorry, we can get answers to your questions, and do it in an interactive way. So
the one question that the one question that we got at the workshop the other night, does Medicare cover long-term care? And the answer to that is no.
That's great. Yep.
Medicaid,
that's not great actually, but you know what I'm saying.
Yeah. Medicaid does cover long-term care, but you need to spend down and liquidate your assets below certain thresholds. So we'll do maybe another podcast on long-term care and planning around that front. But again, when it comes to Medicare, it's again mostly just medical resources. But again, for those of you that are confused with Medicare, like Steve mentioned, message us and we'll try to answer any questions and provide any guidance as much as we can.
That's why we're here.
All right, man. Burning the midnight oil. I don't know how much more we could talk about Medicare before people's ears start bleeding.
Our eyelids start drooping.
Yeah. But again, I know we kind of said a lot with, again, the different parts. Again, you have A and B from the government. You have the prescription plan, and then you can get a supplemental policy, or you can go the Medicare Advantage route. Again, the cost for Medicare is going to depend on your income from 2 years prior. When it comes to enrolling in Medicare, please, if you work for an employer that has has less than 20 employees, you need to sign up for Medicare. Yeah, and as a reminder, Medicare is a slow-moving organization, so sign up when your window opens 3 months prior to your eligibility date.
I like the recap, Jeff. Nicely done.
Yes, it's almost as nice as Steve Benny's smile. But ladies and gentlemen, we've already touched upon that enough. We're going to send you on your way.
I told you about bringing that up.
We'll see you on the next episode. Take it easy, everybody.
Bye-bye.
Thank you for joining us. If you enjoyed our podcast, don't forget to like, subscribe, and leave a comment on topics you'd like for us to cover on future episodes. We'll see you soon.
Financial planning and advisory services are offered through Prosperity Capital Advisors, PCA, an SEC-registered investment advisor with its principal place of business in the state of Ohio. One Team Financial LLC and PCA are separate, non-affiliated entities. PCA does not provide tax or legal advice. Insurance and tax services offered through One Team Financial LLC are not affiliated with PCA. Information received from this video should not be viewed as individual investment advice. Product discussions and illustrations are hypothetical in nature and will vary based on many factors, including but not limited to age, health, product, insurance carrier, and product design. You should consult the insurance carrier website and policy for detailed information. Content may have been created by a third party and was not written or created by a PCA-affiliated advisor and does not represent the views and opinions of PCA or its subsidiaries. For information pertaining to the registration status of PCA, please contact the firm or refer to the Investment Advisor Public Disclosure website. For additional information about PCA, including fees and services, send for our disclosure statement as set forth on Form ADV from PCA using contact information herein. Please read the disclosure statement carefully before you invest or send money.